My colleagues have talking about France and the Netherlands have addressed some of the points that I want to make. So I when I started thinking about this, I had 4 different things I wanted to think about it, which is why loneliness became a policy problem, what we do in the UK, and then a bit about interventions and evidence, and has all this interest in loneliness made a difference, and what did COVID do? And I suspect I only got as far as 1 and 2. So thinking about it. So if I could have the next slide, please. Certainly within a British context, there's been a fairly long tradition of work around loneliness, particularly amongst older people. And some colleagues will have seen this before. This is the earliest UK study that I could find. And I think this set the tone for a lot of the work, probably up to about 2018, that loneliness was seen as effectively a problem of old age. It was almost seen as something that was part of normal aging, so we didn't really need to think about it. And it was also used extensively by age-related charities to in their fundraising and advertising. And you can see the one of the Age UK posters about Joan's life used to be filled with friendship and laughter, and now she has no one. I mean, it doesn't depict a really cheery image of old age. And there's a particular British thing, and I'd be interested to know whether it's the same on mainland Europe, about Christmas and loneliness. Your relatives can be lonely 364 days a year, and that's fine, but nobody should be lonely at Christmas. So it's a very particular British take on that. If I could have the next slide, please. And this stayed more or less like that, as being the prerogative of social gerontologists, if you like. Where the debate started to change in the UK was we had a health secretary called Jeremy Hunt, who I think is currently sniffing around the sort of carcass of Boris Johnson to become Prime Minister and have another go at it. And he in 2013 made this speech, which was probably the first major policy statement linked to loneliness, and you can read it for yourselves there, about loneliness, that we are as a society uncaring, and this is a source of national shame. It is, for anybody who teaches epidemiology or stats, a wonderful example of numerator based data rather than giving us a denominator. So are 800,000 people in England lonely out of 1 million or 60 million? So, but one of the projects I'd really like to do is to interview him, to ask him why at this particular point in time he chose to highlight loneliness. And if I could have the next slide, please. And that sort of chimed with the data and the quotations that we're all familiar about. Loneliness really is a public health problem. That is, it's actually worse for you than smoking cigarettes, which I remain skeptical about. It may not be good for you, but it's definitely not worse than smoking in any way, shape or form. And we started to get a narrative around, first of all, there are these poor health outcomes for people who are lonely, with a simple cause and effect. Loneliness causes dementia, a range of other things, and then started to see it framed in the UK. And again, I'd be interested from mainland Europe, that actually it wasn't just that loneliness was killing people, it was actually driving the collapse of the NHS. So actually it was nothing to do with the fact that the junior doctors were all on strike or we hadn't invested enough. It was because all these lonely people were going along and consulting their GP. And I'm happy to talk about the veracity of that evidence. So if we think about loneliness from a public health point of view, the first thing we want to know from public health is, how big is the condition? How big is it? Is it a small problem, a big problem, or a medium problem? We want to know what the impact is on the condition and on the individual and on the wider society. And I think the other key things for me when we're thinking about policy and interventions is around, can we identify it? How do we know people who are lonely or at risk of loneliness? What are our screening tools, if you like? And then is there anything, is it preventable or treatable? So do we have an intervention that we can roll out that will either reduce loneliness for those people who are lonely or prevent it in those we think are at risk of it? And I think the evidence certainly, I think using those tests is an interesting way to think about the UK policy. So there was a lot going on, I think, loneliness, being rediscovered, thinking about it as a social determinant of health. And then I think we have the influence of some very key individuals. If I could have the next slide, please. And again, I'd be interested to see how this mirrors or doesn't mirror the experience of Europe. So we had an MP called Jo Cox, who was a Labour MP, who was very interested in social connections. And she was about to set, and I, again, sadly, because she was killed whilst out campaigning during the general election in 2016. I can never ask her. She was a great champion for addressing social connections and therefore combating loneliness. And we will never know why she did that. She was killed, and as a result of that, the Jo Cox Commission carried on, as you can imagine, very emotional kind of experience. And on the other side of the slide, you can see that what this commission, which reported in 2018, recommended was that we took national leadership, that we should measure progress, that a call to arms in like, and that every mirroring our colleagues in the Netherlands, that loneliness is everybody's business. So that was a real catalyst. And there's another person who's a TV personality called Esther Ranson, who also has championed promoting social engagement for older people. We also had the charity, the Campaign to End Loneliness. So there was a lot of activity in our third sector. So if I could have the next slide, please. So people talk about the United Kingdom, or the United Kingdom of Great Britain and Northern Ireland, and our government sometimes deals with national things. So the government based in Westminster deals with things like defence, but our devolved administrations in Wales, Scotland and Northern Ireland have control of matters around health, and loneliness is an example of that. So we talk about the British loneliness strategy when in fact there are three. So there's the Connected Society, which was the one that was published in 2018 and relates to England. And that was where we have that report largely mirrors what the Jo Cox Commission said. And I'll talk about that, what the policies were in a minute. And we have a loneliness minister. So ever since 2018, we've had a minister for loneliness in England, but also in Wales and Scotland. So they're generally junior ministers in the Department of Health, could be the Department of Social Services. This is the current incumbent who I had to look up who he was. He's called Nigel Huddlestone. Previous to that, we had Tracy Crouch was our first. Mims Davies was our second. Our third one was the wonderfully named Baroness Barron, and now we have Nigel. So, but each in Wales and in Scotland, they also have their own strategy. So in Scotland, they published theirs in 2018. Wales is called Connected Communities, and came to fruition in 2020. And there's a subtle difference, I think, between them. So the English strategy was very much loneliness. Scotland was about social isolation and loneliness and stronger social connections. And in Wales, the strategy, again, is a bit more, is a bit similar to the Scottish one. So we have 3 strategies with subtle differences implemented in 3 of the countries that make up the United Kingdom. And as is so often the statement in anything to do with social policy, Northern Ireland is different. Northern Ireland doesn't have a strategy, doesn't have a minister, but then it doesn't have a government either. So that's so the situation is variable in the different parts of the UK. So if I could have the next slide, please. And this is just an example. We've got the England strategy, and then we've got the Scottish strategy to just show you there are some variations in what the strategies are trying to do. So the English strategy really mirrors the Joe Cox Commission, which was about improving the evidence base of around loneliness. So thinking about measurement. I think the definition probably across the UK is roughly similar. It's about the sort of deficit in quality and quantity of social relationships. All of our devolved administrations, I think, in varying ways, try to embed the evaluation of the impact of government policies on loneliness. And the other dimension is around perhaps having a national conversation about loneliness, reducing stigma, increasing awareness, recognizing risk factors, the usual kind of thing. And all of our different governments have a mechanism for at the end of each year they do an analysis and publish the results of how they think they've done in addressing the policy objectives. So if I could have the next slide. This is particularly talking about COVID, where the government, all of the governments, it gained more profile in their work. But again, it's a bit like the situation from the Netherlands, that predominantly the responsibility for implementing the strategies, designing interventions and activities is very much devolved down to local authorities, third sector, and particularly in the UK, the Red Cross, like in France, is very involved in the loneliness sector. So the way we responded to it in terms of COVID was pretty much how we were doing it anyway. The government sets a strategy. There are various pots of money that are given to third sector organizations and local authorities, groups like the national parks, to develop and implement initiatives. So there's loads of local initiatives. So if I could have the next slide, please. So here's one example of everybody agreed it would be a good idea to generate better evidence. We could have a common understanding of how we were measuring it. And England, which is on the left, recommended for use in England the 3-item UCLA scale and a direct single item question. And in England, there was a big consultation with academics about what the best measure to use was. We won't go into too much detail there. So in England, that's the accepted measure of loneliness. And for example, if you were, if I live in Surrey, if Surrey Council was doing a walking group to combat loneliness, they would be required to use one of these measures to try and evaluate what they'd done. Scotland decided that it wasn't going to use the UCLA scale, and instead of asking how often, decided to ask how much of the time in the last week have you felt lonely. So a very different point of view. And Wales decided to use the 6-item de Jonge-Gerveld scale. So although we've all decided we want to have better evidence and that we should have a standard measure, the measure is not the same across the UK, which makes making sense of anything challenging. And that's just an example of we were all working on the same strategy, but just didn't come up with the same answer. If I could have the next slide, please. So this is data that was produced for England just around about the time the loneliness strategy was published, and it caused quite a lot of quite a lot of alarm and consternation for people like me who are interested in old people to suddenly discover they were the least lonely group in society and that we better soon take an interest in young people. This was, I think, in some ways, these data were more influential amongst some areas of the policy agenda developing, because it changed how we saw loneliness. We'd always seen loneliness as a problem of older people and not really bothered about anybody else. And so the fact that it was identified amongst younger people, and indeed younger people seemed to have the highest prevalence, I think was quite a surprise to many, myself included, so I've suddenly taken an interest in young people. And that, I think, reframed the debate in perhaps a way some of the other data hadn't. And I'm happy to talk to that a bit more. So if I could have the next slide, please. We have a lot of data in the UK, and I'm sure you do in Europe and North America, about loneliness and COVID, most of which is really not worth the paper it's written on. There's some extremely poor research. So we have many cross-sectional studies, and here we one that says majority of Scots feel lonely during the COVID outbreak, which was in a magazine or an online survey. So there's a lot of data bandied around. We have some studies that are just during COVID, some studies that have got a before COVID and a COVID measure, but very few studies where we've actually been able to look at people's levels of loneliness in the UK before COVID, during COVID, and after COVID. And I've found 9 studies that had a longitudinal element and had 3 data points, for what it's worth, with different measures calculated in different ways, but 1 showed a decrease, 2 showed no change, and 6 increased loneliness. But the question is that change significant, and was it due to loneliness? So were there other things that were going on? So I just put that in because I thought, to think about how we can quantify the impact of the epidemic. And I'll if I could have the next slide, please. I think I've got just a couple to go to think about. So I'm, again, thinking about from a public health point of view, let's assume we can screen people who are lonely. What are the most effective interventions? And this is just a list of different interventions that we have in the UK, most of which are aimed at individuals. So there's very little thought in policy terms, a little bit, but not much, about how the neighbourhood, the quality of the neighbourhood, the infrastructure, and the provision of public facilities like libraries can be used to mitigate it. It seems to be thinking very much about the individual rather than the wider social context. As you can see there, we've got postmen and libraries, and my particular favourite, keeping hens. About lots of things, and it's very unclear. And if I can have the next slide, please. My colleagues and I at Brunel undertook, as part of the loneliness strategy, a review of interventions for loneliness, and which is available but was not given too much publicity. And if we look at the data, actually for studies that have been conducted, there is very little evidence to support anything in terms of outcome measures and follow-ups. And I'm happy to talk about that. But so much research has we don't know if they're targeting the right people. So in some studies, some interventions, we don't know if the people who are, inverted commas, participating are actually lonely. And then quite a few, and I could go into more detail, but I think the quality of the work is exceptionally poor. So, or at least it was when we did this review, and I've not seen any great signs that it's improved, because actually we need really good evidence to support, I think, interventions, which, and of course these are for older people, and who knows what the evidence is for younger people. So if I can have the final slide. So I'll just conclude with this. I think in the UK we have lots of strategies, but as I say, they're implemented differently in the different home nations, and I think are largely delivered and monitored and evaluated at small scale local levels, and a lot of it is quite ad hoc. I would say, as a conclusion point, that and for Brits, you know, the idea that you might go and talk to somebody on the train is really quite a traumatizing concept, really. But I think one of the things that COVID did do in many communities in Britain was, when faced with a problem that meant that for most of us our lives were disrupted and we spent quite a lot of people at home, a lot of initiatives sprang up at local level. Like I walked the dog for my neighbour, you know, three doors down, who was disabled, but the dog was, you know, a companion. Her daughter, who walked the dog, couldn't come and walk the dog because we weren't allowed to travel, but because I lived 3 doors down, I could do that for her. So a lot of communities galvanized and organized themselves to try and support people in that difficult circumstance. Most of the activity was around practical things, but probably had as much benefit in addressing feelings of loneliness, and perhaps also giving people the opportunity to reciprocate. We often see people as beneficiaries of our largesse to make them feel less lonely, but actually giving people something where they can contribute, I think, was also, from COVID, quite an eye-opener. And I'll stop there, because I'm sure I've had more than I should. Thank you.